Patric Lehnhoff is a registered nurse with the Kenora Area Health Access Center, and he's encouraging his clients to start using insulin earlier in their treatment. Here he demonstrates just how easy it can be.
Ready?
Ready.
Okay. So push this and the cap comes off?
Yeah, no, actually, no. Mike, it's completely set up.
Okay.
So what I'm trying to get you to experience here is what somebody with type 2 diabetes goes through kind of on a daily basis. You're going to do one blood sugar, but often individuals with type 2 diabetes take 4 to 6 blood sugars a day.
Right.
So I'll get you to just take the strip and put it into the meter here to begin with.
Even though there's nothing on it?
Yes, correct. So the strip will go in the meter.
All right.
It's asking for blood, so it's ready to go.
All right.
So you'll just simply take your device, put it beside your finger, and press the blue button. I've already set it up for you. Okay, and
so
that'll draw. Yeah.
Side of my finger?
Exactly, just a little further, and right on your skin.
Okay.
Press the blue button. Oh, we'll just bring it back to make sure it's loaded.
Oh.
Yeah, now it's loaded. Very well. Okay.
Wow, didn't even feel that.
You didn't feel that.
No.
So I'm just going to get you to try to get a little more blood out.
Okay.
Usually we don't want to squeeze too much, but we'll do it today.
All right.
Just for the audience. There we go. We're letting blood here.
Zoom in, zoom in.
And we'll just
just
onto the strip. It sucks it up like a tube.
Wow.
Okay. Just going to grab a Kleenex here. Laura's going to grab one. And we're checking out your sugar. Okay, and your sugar this morning is 6.5, Mike. That's not too bad.
Wow.
All right, that's pretty good. So after we're done with the test, we just pull the strip right out and we put it in this sharps container so you can pull your own strip out. There we go.
All right.
Excellent.
Cool.
So the next thing I wanted to share with everybody is just the use of common insulin pen that we use. More and more now we're finding that insulin helps in individuals who aren't able to get their blood sugar in control, particularly their A1C. Okay, so that's a 3-month average sugar that we measure on a blood cell. So many patients resort to insulin, and it doesn't mean that you're not doing well in your diabetes. It just means this is a time where we need to help the body in supplementing the insulin the body's not making. Okay, so I'm going to get you to just give this a shot. I can grab these devices.
All right.
There we go. So there's the pen. It looks a lot like a marker. Okay, it's not much different.
Does, yeah.
So you can just take the
cap off.
The cap off there.
Right. Yeah.
There you go. Okay. Here's the needle that attaches to it. It's much different from the traditional needles we used to use that we drew out insulin from.
Okay. You take this off.
Yeah. You just slip that off, and you screw it onto the end of the insulin pen. Yeah.
Okay.
There we go.
Okay.
So you can give me that cap. I'll hold it for you. Usually you do this at a table, so I'll just hold the cap for you.
All right.
That little green cap comes off, and that can go in the garbage.
All right.
Okay. And there's the tiny little needle that I'm talking about.
Okay.
Okay. It hurts much, much less than even checking your sugar.
Okay.
And thank you, Mike, for being for giving it a shot.
Okay.
So each day in Kenora, there are probably between 500 and 600 patients who take insulin.
Really?
Yes. Certainly in the First Nations population, I would estimate that.
Wow.
And they find it very helpful for their health, and it really improves their outcomes.
Okay.
All right. So we'll just get you to, I'll hold this, and we'll just get you to roll up your shirt a little bit there.
This is not rolling up the rim. But
this isn't rolling up the rim. We got roll up the rim across the street. But
don't zoom in on that.
So we'll just find an area on your belly, and that's perfect.
All right.
Okay. You can just hold your skin kind of flat. That's all you need to do.
Get my tie out of the way.
Yeah, exactly.
Jeez.
There we go.
All right.
Yeah. And the needle goes straight in, not at an angle, straight in. We'll hold it in. Yeah, go ahead. So normally an individual who is on insulin would be dosing it, but we're not. This is just a dry injection. Now don't do this at home, people. So I'd say, there you go. So that was about 4, 5, 6 seconds. Patients would hold it in there for about 10.
Okay.
So you kind of got out a little early, but how did that feel?
I didn't feel anything really.
Exactly. So there you go. No fear of the pain of using an insulin pen. So you'll just recap it.
Okay.
We always want to make sure that we're putting it in sharps containers. Some people, you just the pen is reusable. It can be used for up to a month.
Okay.
there we go.
Okay.
And this sharps container, once it's been filled up, you just bring it to your diabetes team or you bring it to the hospital. They'll dispose of it correctly.
Okay.
We want to avoid putting it in landfills because the last thing we need is, these type of sharps containers hurting workers who work in landfills or anybody who might have come across garbage.
Sure.
All right.
Okay.
Well, Mike, thanks so much for doing this.
Well,
I'll
thank
get you
you.
to recap that.
Okay.
So how did you feel about doing the test and the insulin?
Fine.
Yeah.
Mm-hmm.
Yeah. So we can see here that there's really not that much pain involved,
Right.
which is I think a misconception that many people in the public have. The other thing is,
I'm glad he's doing the interview. I really am.
the other thing is that please be respectful of patients who use their insulin.
Mm-hmm.
This is for the public and also people with diabetes. Please be respectful of people using insulin in restaurants.
Mm-hmm.
They do often take insulin with each meal,
Mm-hmm.
and it's a very important part of their treatment and their health care needs.
So if you see something at the table, so
Yeah,
that's what they're doing.
they're likely taking their insulin.
Mm.
And many patients feel uncomfortable doing that, and they might hide away and go to washrooms
Right,
and do that.
right.
When in fact, we would like to build an environment that kind of supports that, because there are downsides to rushing off to the washroom and doing that. It's ideal having it done in front of your meal.
Mm.
Okay.
So the timing is
The
important.
timing is important. Okay. So
Okay.
again, for everybody at home, don't do this at home. Okay. Definitely have your diabetes team involved, your physician or nurse practitioner.
Okay.
Okay.
Laura Stokes is also part of the interdisciplinary team. She's a dental hygienist who's the first in Canada to write the exam to become a diabetes educator.
There's an exam for diabetes educators,
Thank you.
and I'm the first dental hygienist to be writing this exam. Through the Kenora Health Access Center, I get to work with patients that have diabetes, and I get to stress the importance of oral health. One of the other really important things is foot care, and basically the reason for that is if you have an open sore on your foot, diabetes basically prevents that from healing well, so that you need very proper care. So when you have an open sore, say gingivitis in your mouth, people tend to not relate that to being the same thing, but you need to have proper oral care in order to reduce that so that you can hold on to your teeth for a long time.
I had no idea that was, okay.
Yeah, yeah. And actually for people that have diabetes, we typically recommend that they have their teeth cleaned every 3 to 4 months.
By professional.
Yes.
Huh, okay, all right.
Yeah.
So that's why you decided to go the extra step and take that.
Yeah. So again, going back to like an open sore on your foot, if you have gingivitis, so your gums are bleeding, and you have periodontal disease.
Which was what? That's just a disease in your mouth? Or?
Yeah, it's bone loss.
Ooh.
Yes. So when you have an open infection like that, it's going to increase your blood sugar level. So by having that proper care and reducing the chances of getting periodontal disease, you're going to help control your blood sugar level.
Great.
Significantly.
Okay.
We can take people off insulin once their teeth are looked after.
Okay.
On some occasions. Yeah. Sorry, Laura.
Thank you very much for doing this.
Thanks.
Thanks for coming.
Thank
My
you.
best to Crystal. And
For Kenora Online, I'm Mike Aiken.